Here's just a couple of minutes of very basic neuroanatomy to help explain why visual field defects present differently according to the location of lesions. To start with, we need to remember that a light source placed in between our eyes is seen by the lateral aspect of the retina. Light sources placed to the temporal side of our vision are seen by the medial area of the retina. Impulses seen by the retina travel bilaterally along the optic nerves, with some crossing over at the optic chiasm. Normal vision with no visual field deficits is drawn in the notes like this. If the patient's left optic nerve was obliterated, for instance by optic neuritis or anterior optic neuropathy, the visual field deficit would be a complete loss of the vision of the left, drawn like this. If the optic chiasm was compromised, for instance by a pituitary lesion, then the resulting field deficit is bitemporal hemianopia, hemianopia meaning half blindness. If the optic tract was compromised, for instance by stroke, then the resulting visual field defect is a homonymous hemianopia, in this case the patient's right, because temporal vision from the patient's right eye and medial vision from the patient's left eye are both lost. Let's expand on this by using a sagittal section, remembering that light sources inferior are seen by the superior part of the retina, and light sources superior are seen by the inferior part of the retina and travelling in the upper and lower parts of the optic nerves. The absence of a visual field deficit is drawn like this. Lesions above the chiasm, such as craniopharyngiomas, result in loss of the inferior part of vision, in this case resulting in bitemporal inferior quadrantinopia. Similarly, lesions below the chiasm, such as pituitary adenomas, result in loss of the superior part of the vision, resulting in bitemporal superior quadrantinopia.